In this video, I'm going to talk about scene assessment and show you a universal approach and set of steps that you can use for any emergency, big or small. The very first thing we're going to do is assess the situation and determine if there are any dangers to avoid or control. You should only approach if it's safe for you to do so. As first aiders, you might naturally want to jump in immediately to help somebody, especially if it's someone you know or are responsible for. Taking that moment to stop and assess the situation will make you see the bigger picture, make better decisions, and be aware of any dangers to yourself and others. One hazard that's pretty universal is the potential transmission of bloodborne pathogens or viruses, so we want to make sure that we're protected with gloves and a barrier device, like a pocket mask if we have to give breaths. Next, we want to know what happened. Asking what happened is a pretty automatic response when we see somebody who's injured. It's also typically easy to find out. When someone's hurt, they'll usually tell you if they can. If it's a serious injury and they can't tell you, we can ask a bystander. If no one's around, we can take a look at visual clues to make a guess for ourselves. The main thing that we're trying to find out here is whether or not this person might have hit their head. If they did, they might have a neck or spine injury, and in that case, we'll try not to move them unless we have to, like if they weren't breathing. If no one saw what happened and the person isn't able to tell us, we'll assume that they may have a spinal injury, and we won't move them unless we have to. Once we know that our scene is safe and whether or not we're worried about a spinal injury, it's time to check the person. Are they awake? Usually you can tell pretty quickly. They might be talking or yelling depending on the injury. If they're not, try to approach them from where they can see you. Squeeze their shoulder or their hand to see if they respond.
Are you okay? Are you all right? Whoa, 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 hey, whoa, okay, all right. I'm gonna need some help over here. Ashley, wake up. Wake up, Ashley.
If they're not responding, check to see if they're breathing. Place 2 fingers under the chin and your hand on their forehead. Bring your ear close to their mouth and look for signs of normal breathing for up to 10 seconds. Look for the rise and fall of their chest or back and listen for abnormal breathing. Once we've assessed the scene and we know if the person's awake or breathing, it's time to call for help. Ideally, there's somebody nearby who can call 911 for us. If not, we might need to call 911 ourselves.
I'm gonna need you to call 911 to 123 Lollipop Lane. I'm gonna need an ambulance right away, do you understand?
The person calling needs to know the nature of the emergency, whether the person is responsive, and the location. If they have to leave to make the call, tell them to come back and confirm that the paramedics are on their way.
Great, I'm gonna need a first aid kit, an AED, and a blanket.
If possible, ask somebody else to bring you a first aid kit, blanket, and AED. Now that we've checked the scene, the person, and called for help, we can finally start caring for this person. Typically, you'll get to this step pretty quickly. Unless you run into hazards, checking the scene, the person, and calling for help doesn't take long at all. We'll start by caring for the most important and life-threatening issues first. We call these the ABCs of first aid. A is for airway. The person's airway needs to be open and clear. We've already checked breathing, so we know if the person has an open airway. If their airway wasn't open, so if they were choking or positioned in a way that makes it hard to breathe, we need to fix this first. B is for breathing. We're all familiar with breathing, and we know what good breathing should look like and sound like. If the person's not breathing or not breathing normally, we need to address this immediately by starting CPR. C is for circulation. This refers to the heart pumping blood around the body. If somebody's breathing, we know their heart is beating effectively, but we can look a little bit deeper into the quality of the circulation. Look at their skin. With gloved hands, check their forehead temperature. How does their skin feel? It should be dry and warm and close to the person's normal color. Poor circulation can look gray or pale, maybe a little bit green depending on their complexion. If they have darker skin, this can be more challenging to see, so you could try squeezing a fingernail to see if their color quickly returns when you let go. Their skin might feel cold and clammy as circulation gets worse. D is for deadly bleeding. By deadly, we mean a lot of blood and fatal within 4 to 7 minutes. The blood might be spurting or creating a rapidly growing pool. If a bleed is deadly, it'll usually be the first thing you notice, but in certain situations, it may not be so obvious. Maybe it's dark, the person's wearing a lot of clothing, or they're on sand or snow, or maybe even in the water. If this is the case, we can do a rapid body survey to look for blood or additional injuries. With gloves on, start at the top of the head and move down. Check your gloves frequently. Don't reach under the person. You can also check for medical necklaces or bracelets as you move down the body. E is for everything else. If the person's breathing, there's no deadly bleeding, we can move on to everything else. This means protecting the person. So we're going to want to protect their head from movement if you suspect a spinal injury. And we want to continue to protect them from other danger. We also want to protect their dignity by directing people to avoid crowding the injured person or recording the person with their phones. Use warmth, rest, and reassurance. This can be as simple as giving the person a blanket, having them rest in a comfortable position, or helping them into the recovery position and talking to them calmly.
Okay, you're gonna be all right.
This is also the point at which we treat other injuries and conditions that may not be immediately life-threatening, like sprains, strains, cuts, and burns.